Welcome everybody. This is the Under 16 Cancer Patient Experience Survey, Workshop 1. We've got a packed agenda today, so I'll briefly talk through what it looks like. So we've got, I've just covered the introduction and housekeeping. I'll be handing to Jodie Moffat from NHS England in a minute to do the welcoming and opening statement. Then we've got our colleague from Picket, AJ, who will be talking through the overview of the quantitative national results from 2023, and then Estelle from NHS England will be covering the qualitative data. We've got some really inspiring parents with us today. So we've got Sam and Charlotte, who will be talking about sort of Henry's Wi-Fi legacy and Sophie's legacy, respectively. My colleague Caroline will be talking through understanding the different outputs to help you sort of navigate the different reporting outputs and data tables as part of this suite of reporting results. And then finally, at the end of the session, Neil from NHS England will be closing out the session. So without further ado, I will hand over to Jodie Moffat, who's Deputy Director of Policy and Strategy for the National Cancer Programme at NHS England. Thank you.
Thank you very much, Amy. Good morning, everybody. Really good to see you all on the call this morning. Thank you so much for joining. Yes, as Amy said, I'm in the cancer programme at NHS England. Experience of care is really important to us in our work, and we work really hard to try and understand experience of care and to make improvements that will mean that people get a better experience of care than they might have done otherwise. We're delighted that we are seeing this work happening now also for our under 16s community, and this is the 4th iteration of the under 16 cancer patient experience survey, which not only provides a really valuable national picture about how experience of care is felt by parents and crucially by children themselves, but also provides information at a local level that systems can use to understand what is working well, what's not working well, and to really further that continuous improvement. I think today we've really taken on board some feedback from the previous times that we've run this webinar to not assume that you've had a chance to spend much time looking at the results themselves, because appreciate how busy a time it is, particularly at this time of year. So it'll be great to hear later from AJ and other colleagues who will take us through the top line findings. But I would really encourage you all to be able to go away and take some more time to look at those findings again, look at your local data, to triangulate it with other sources that you have locally as well, to drive that improvement and understand what's working well and what could be improved for the communities and patients that you're serving. I just, before I move on, I just wanted to say thank you so much to everybody, to the trust, to staff, everyone involved in the survey. I know there's a lot of work that goes into making this happen, and it's really important that we say thank you for that, but also thank you in anticipation of the work that you are going to be doing to actually look at these results and to drive change and improvement off the back of them. That's something that we absolutely do owe to the people who took part in the survey, but of course just generally everybody who uses our services. So thank you again for the work you've done on this, and we'll continue to do so. I think we've got a really interesting agenda today, and it's great to hear about some of the things that have been changed and happening and improving over the last year or so, and some of the work we'll hear about from Sam and from Charlotte. Okay, I think I'm going to hand back to Amy now.
To me, Jodie. Thank you.
Okay.
Yes. Thank you very much. Thank you very much for the introduction. We are ready to have a go through the national quantitative results. These will be presented by our Senior Insights Associate, AJ.
Thank you, Marcus. I'll get you to move slides on as I talk, but much appreciated. So welcome, everybody. My name is AJ. I will be taking you through some of the quantitative outputs from the 2023 survey. Given the limited time here today, I will focus on providing you a tour of the results rather than an exhaustive list of them. There is much more available, and we'll be finding out where that is just momentarily. Marcus, if you could hit the next slide, please. Thank you. So the under 16 cancer patient experience survey, I will probably end up referring to as CPES a few times through this. So if I do, that's what I mean, is an annual survey, as Jodie said. It measures the experiences of tumour and cancer care for children across England. It's designed to monitor national progress of experience of care and for children who are under the age of 16 at the time of their care and discharge. So that kind of puts context around who we're looking at here. Of 3,741 people who were invited to take part, 949 responded. So quite a good sample size in some respects, but in other ways, when we're looking at some of the breakdowns in particular, that will lead to some small numbers. And so you should take caution when you're making comparisons, particularly at a PTC level. In terms of online versus paper, it was 656 versus 291. And the full methods, demographic breakdowns, and questions not presented here are available in the full report, which is at that web address there. So www.under16cancerexperiencesurvey.co.uk, and the technical appendix will have a large number of results in that. Next slide, please, Marcos. So first of all, let's look at the overall experience of care before moving across particular parts of the care journey. The light blue bars here in the kind of color that matches that banner are going to be the overall data, and the shades of pink present data from each survey version or age group, because this survey has 3 versions, one for the youngest children, who are typically answered by the parents in most parts there, and then 2 more versions for progressively older children and their parents as well. So when we look at this, we find that 88% of parents or carers rated the overall experience of their child's care as 8 or more out of 10, ranging from 87% for the 0 to 7s to 89% for the 8 to 11s. When we're looking at how children are reporting their experiences, though, 82% of them reported that they were very well looked after by staff for their cancer or tumour, and ranging from 81% for the 0 to 7s to 83% for the 8 to 11-year-olds. So fairly similar picture, but nonetheless there are some differences, and particularly there that's flip between the older age groups in terms of how they are reporting their experience versus how their parents do. Although, as I say, some caution here due to some lower numbers perhaps. Next slide, please, Marcos. So what does that look like when we do some breakdowns? Because we have quite a number of breakdowns that we can do. So as we look at ethnic group, we find, remembering ourselves here, that 88% rated the overall experience as 8 or more. We see quite a variation here, from 88% for being the white group, but 83% for Asian as the 8 to 10. But some wide error bars here, so lots of overlapping estimates of care experience. Marcus, to the next slide, please. We can also look at how this maps to deprivation. So the deprivation we use here is the English Index of Multiple Deprivation, which has many indicators. I think it's 39 now in the latest iteration, over 7 domains. So it gives a good indication of what the sort of socioeconomic and socio-demographics are in a region for a person. And we can group that by dividing the deprivation data into 5 groups. These are known as quintiles. So the most deprived areas are in quintile 1, and the least deprived are in quintile 5. So that's how this one would range out. And you can see here again that although there are overlapping confidence intervals, it is hard to draw conclusions to that extent. There does appear to be some effect of deprivation here. Moving on again then, please, Marcos. Thank you. So we can also look at diagnostic group, another really important topic, of course. This is where we can begin to delve for you, particularly at PTC level, into your case mix. And we can see here that actually some groups are suppressed. And again, there's quite an overlap of confidence intervals, but you do see some differences in experience here in particular. So the percent of carers rating for ranges here, rating the carers 8 or more out of 10, ranges from 83% to 95%. And then in the sort of less good ratings of care, you can see quite a wide range there, the lowest being suppressed, of course, but then 5% up to 15% with, of course, these overlaps. On to the next one, please, Marcos. We can also look at whether the child receiving care here also had a condition other than cancer as well, that affects their health. There are quite a number of other conditions that are asked after, but for the purposes of this presentation, we've just grouped them together as having another long-term condition or not having another long-term condition. We find here that 88% of parents or carers, rated the overall experience of care as 8 out of 10 or more, ranging though from the 83% for having another long-term condition to 90% for no other long-term condition. So the implication being, of course, no other long-term condition held a better experience of care. Moving on again then, please, Marcos. Well, let's actually look at some of those aspects of the care journey then. So first of all, turning to how did you feel about the length of time you waited between being referred by your GP to a hospital doctor until you were then seen at that hospital? So this is asked to a smaller number of people. And what we can see here then is that actually only 70% of parents or carers felt that they were seen at the hospital as soon as they thought was necessary, with then 30% being seen not as quickly as they would have liked. And actually by age group, quite a variation, although again, overlapping confidence intervals in the estimates here. What this means, let's turn the numbers back into people because that's what we're dealing with here. It's around about 50 people in this survey didn't think they were seen fast enough once they had a referral. Moving on to the next slide, please, Marcos. Thank you. And again then, so finding out about the cancer, were you told about the cancer or tumour in a way that you could understand? And again, we can see 73% of parents, carers and children reported information at diagnosis was definitely given in a way that they could understand. But the total response here is again a kind of not the full number. It's 287 people have replied here. Again, what does that mean when we turn this into people? Well, around 78 people were not given the information in a way that they could fully understand. Interestingly, you note a decline there in the yes definitelys for the older age group of children. Again, overlapping confidence intervals, hard to draw a firm conclusion, but it's perhaps indicative that the support there, if maybe they haven't got a parent with them quite so much, or the information's being held off in a way that's just not resonating well enough. If you move on, please, now, Marcos. Sorry, could I have the next slide? Has it stalled out?
Sorry.
Thank you, no worries. So once arriving in a hospital then, sorry, was it missed a slide there? I was expecting a different one.
We are on healthcare staff. AJ.
No worries, no worries. I was expecting a different one. No trouble, thank you. So when your child was in hospital then, were they able to get help from staff on the ward when they needed it? Could you get help from staff on the ward when you needed it? So in this one, we can again see 70% are saying yes, always. Sorry, this is slightly out of what I was expecting. But maybe not so much going on between the age groups. Those are pretty similar responses. Next slide then, please, Marcos. Were you able to access reliable help and support 7 days a week from the hospital team? So in this case, actually, we see that only 58% of parents or carers reported that they definitely had access to reliable help and support 7 days a week from the hospital. With some effects in the age group, so you can see, although again with these overlaps of confidence intervals, that we're looking at some differences by age group. Next slide, please.
Is it the right one, AJ?
For my screen, it hasn't moved on. Has it moved on for other people?
No.
Okay, let me go back, then go back again. Can you see it?
We're on the hospital feed.
There's yeah, there seems to be a lag with the slide changes. It may be worth stop sharing and then re-share again, Marcos. Sorry to be a pain, but it might fix it. Sorry, everyone.
My apologies. Fabulous, thank you. So looking at food here. So I want to now go back into the hospital, having just said, what was the support like when you were away from hospital? Could you access the team? Well, there are three topics that I really want to focus on here, and we'll hear a lot more about them as we do from particularly Charlotte and Samantha coming up. So hospital food was not always suitable for many children. In fact, you can see the yes definitely here, particularly for the older group, is 31%, with an overall rating here of yes definitely by only 38% of the respondents. Can you go on to the next slide, please, Marcos? Thank you. So another really important topic was play support available in hospital when your child needed it. This could be higher for many children as well, 52% for the group overall, with some differences as the age group increases, so that yes always is higher for the older age group. Next slide, please, Marcos. And hospital Wi-Fi, did it always meet your and your child's needs? Well, essentially the answer is not really. 36% of people overall said that hospital Wi-Fi met their needs. You can see again some differences here that you know, the yes sometimes is higher for the older age group, but the yes always is lower for the older age group. Again, some fairly wide bars here, but this will come up again in Henry's story coming up soon. Before we move on to the next part of the presentation, I'd like to just highlight to you that the main report, which is available on the website, covers so many more questions and breakdowns and includes data for the last survey iterations to give you the ability to monitor over time and draw conclusions from those findings. I'd be really keen that you do look at data over time. Whilst it's useful to look at these as kind of this year's spot, this is what this year's survey has said, looking at trends over time is going to be really key for driving improvement. Now, moving on, I'm really pleased to introduce Estelle to you, who's going to take us through the qualitative data that are available as part of this survey, and will help us focus on the people that these numbers have attempted to summarise, because that is the absolute key message here, isn't it, is that we're dealing with people's experience. So thank you very much for listening to me. Sorry for a little bit of tech lag as we went along. Over to you, Estelle.
Thank you. Yeah, so I'm Estelle, Qualitative Senior Analyst at NHS England, and I'm here to talk to you about the qualitative findings. So when I'm talking about the qualitative findings, where they're drawn from is in the survey, respondents, with the exception of children aged 0 to 7, were given the opportunity to say in their own words if there was anything else that they would like to tell us. So they were asked two questions: what was good, and another asking what could have been better. And we got almost 1,500 comments through that, left by 664 respondents, and we analysed 668 of those to draw out themes about what people were telling us. So it's those themes and findings that I'm going to talk about today. I'm not going to talk about the analysis methodology that was used, but that's, if you're interested in that, that's available in the main report. What you'll see as I talk through, I have added respondent quotes on the slides. They're in blue speech bubbles. So what they do is sort of evidence the kind of information that people tell us that the findings are drawn from. Okay, next slide, please. So there were 7 main themes that came out of the analysis. So I'm going to talk through each of those in turn. The first one was all about staff. So the sort of headline finding there was that staff was central to experiences of care, and positivity about their manner and personal attributes was frequently raised. So yeah, positivity about staff, that was the most prevalent theme, as in it came up, it's what people talked about the most. And there people are using language to describe staff such as friendly, kind, caring, supportive, compassionate, understanding, helpful, professional. And what those comments brought out as well is how staff acting in that way brought some happiness and fun to children. It made respondents feel calmer, supported and more comfortable. And another aspect was staff listening, understanding and involving people, and that was seen to facilitate joint decision making and a personalised approach to care. Also helped build trust and strong relationships with staff, and it made people feel valued and safe. So as I've described, we had this whole bunch of comments, people being really positive about staff they encountered. There were a few exceptions to that. So there were some older children and parents carers who indicated that not all staff acted in a friendly or empathetic way. And this sort of worked to demonstrate how all members of staff play a critical role in how care is experienced. So next slide, please. So the next theme we had was all about communication, and what we saw there that people talked about a range of features that characterise good communication between staff and parents, carers and children, and also some opportunities for improvement as well. So where communication with staff was viewed positively, the data drew out what it was in particular that was valued, and that's in those light blue boxes towards the top of the slide. So what we heard was people appreciated it when information was clear, staff were proactive in providing that information, they were receptive to being asked questions, they were actually able to provide answers, they took enough time to provide explanations, people were given the opportunities to ask questions, and staff tailoring information to make it understandable, including to children, and also staff addressing children, not just parents or carers. So that was what was happening when things were going well. Less frequently, respondents indicated there were some opportunities for improvement, and they tended to focus around privacy, sensitivity, timeliness, consistency, and reassurance. So some examples there is people talking about how there needed to be careful consideration around whether information should be delivered in front of children. We had that telephone calls were not always considered an appropriate or convenient way to receive sensitive information, and also saw some issues with people being kept updated without needing to chase staff and services themselves. Okay. Next slide, please. So some other aspects of communication that came up was poor communication and coordination between different hospitals, and that could lead to parents carers having to liaise between the two themselves. It was also pointed out that the use of different electronic systems could contribute to that poor communication. Some poor communication between staff within the same hospital service was also observed, and there it was suggested that continuity of seeing the same member of staff is something that could help mitigate that. And the data also indicated that the ability to communicate with services outside of hospital stays was variable. So there were suggestions that being able to contact services outside of normal working hours could have the potential to lead to improvements. Okay, next slide, please. Okay, so the next theme is all around access to care, and again, a few different facets to this theme. The first part was about staff not always responsive to needs, that being attributed to understaffing, and that was particularly seen at weekends, evenings, and at night. So here, the staff assistance in hospital wasn't always timely, and people described having long waits for call bells or buzzers to be responded to, and also for their medication to be received. This was often framed as a systemic issue, so rather than being directly critical of staff, respondents would link it to understaffing and staff being overstretched as a result. In some cases, parents and carers have been concerned that inadequate staff or a lack of specialist staff has contributed to poor clinical decisions and errors. Next slide, please. So other elements of the theme, so there was comments around diagnosis and treatment. So for some people, care started very quickly, where others talked about there being delays. Where delays were seen, parents, carers could feel that healthcare professionals weren't listening to them or taking their concerns seriously. The length of time to get a GP appointment or to have tests and scans were also seen as contributing factors to delays to diagnosis. Also saw respondents described long waits in hospital, and that could be for chemotherapy, operations, and at the pharmacy as well to prepare medication. And this was discussed alongside a lack of bed availability. And it was really clear when you looked at the data how these different issues could be intertwined with each other. So, for example, a patient ready to leave hospital might have to wait a long time for pharmacy to prepare the medication, which in turn wasn't freeing up the bed for another patient. And these things were said to contribute to long days, boredom and stress. Okay. When it came to travel, there was a strong preference for local care. Where people were living further away, they suggested there should be more consideration of accommodation for parents' carers, and also having appointment times that counted for travel time. So, for example, if you had someone who had to travel 3 hours to an appointment, not having an appointment that started at 8:30 in the morning. And there also could be long waits for hospital transport to arrive. Okay, next slide, please. So the next theme is about personalised care, and there was two really distinct aspects to this theme. So the first one was around unmet needs around psychological support, and that was seen for both children and parents carers across all the age groups and also spanning multiple stages of care. The few positive experiences that people shared indicated that charities could play an important role in providing psychological support. And then the other different aspect was variable experiences around whether the specific needs of autistic patients had been considered and met. So there we heard that some staff were said to have good awareness and understanding of needs, whereas others didn't. And some things that came out as important for autistic patients were the need for routine and structure. So things such as seeing the same member of staff, having a breakdown of what would happen on treatment days, so they knew what to expect. And also sensory needs came up with those not always being met. So that there were suggestions for better consideration around the sensory experience of the environment, things like noise, lighting, and the texture of food was something that was also mentioned. Okay, next slide, please. So that takes us on nicely to a big theme in the data, which was about hospital food, which very much matches up with the quantitative finding that AJ shared. So hospital food, it did come up frequently as an area for improvement, and we saw that there could be issues around quality, choice, how well food met personal needs, food preparation facilities, and provision for parents or carers to eat as well. Yeah, it did come up, was raised a lot by children. It just sort of, the data really indicated the significant role that food played in how they experienced their time in hospital. So there was a view that the quality of food was poor, could lack nutritional value, and children having limited choices. When it came to specific dietary requirements, they weren't always considered or met, and that included how cancer treatment was impacting on patients' appetite, their taste, and their ability to eat. So food being restricted to set times could be problematic because that didn't always align with children's ability to eat, and it was inferred in the data that a degree of flexibility was needed. The few positive experiences were shared also indicated a flexible and personalised approach was the key to success. So there people talked about the benefits of having an on-ward chef and children being able to order food at a time that suited them. Okay, next slide. Okay, so the other couple of aspects that came up in relation to food was, first of all, parents, carers expressing a need to have access to kitchen facilities so they could prepare and cook food for themselves while their child was in hospital. So in some cases, people said there were no facilities. In other people said there were facilities, but they could be inadequate. The kind of improvement suggestions that came up there were things like having larger fridges or freezers, more appliances such as toasters, and actually some older children also commented that they wanted access to microwave, a kettle, vending machine. And there were a few comments as well about just making sure that kitchen facilities were monitored and clean. And then the final aspect of the food theme was parents and carers suggesting hospitals should provide food for them in addition to children. And the reasons given for that was it could be difficult to leave their child, but also the financial impact of having to buy food sort of at outlets in and around hospital. And there are a few people said they were willing to pay a fee for being fed in hospital. Okay, next slide, please. So the next theme is all around things to do in hospital. Again, there are a few different aspects to this. The first one is around play. So it was really clear in the comments from children how important it was to have play incorporated into their care. And that included access to playrooms and play specialists. And the role charities played was also acknowledged. So charities coming in, providing activities, providing gifts for children, that was appreciated. Where people talked about a need for improvements, they tended to focus on activities not just being geared towards younger children, more provision for children in isolation and increased access, including at weekends. And the next aspect was around poor Wi-Fi, again, very much backing up the quantitative findings that AJ talked about. So having poor Wi-Fi was said to limit entertainment options. It reduced contact with friends and family, created a barrier to schoolwork and parents' carers' ability to work. Children also said they wanted access to TVs and video gaming consoles, but they weren't always available or working, so that was important to them. Okay, next slide, please. Then the final aspect to this theme was about education. So children, particularly those aged 8 to 11, gave positive feedback about hospital, school and teachers. Similarly, some parents, carers provided comments that schooling had been good and they praised the quality of education provided by the teachers. Where they were more critical, that tended to focus on insufficient access, and there were suggestions that education should be provided from the start of treatment and also being extended to weekends and school holidays. Okay, next slide, please. Okay, this takes us to the final theme, which is about the hospital environment. And here, noise at night impacting sleep was common. There were suggestions of how this could be improved. So it was impacting on people's, both patients and parents' carers' ability to sleep. And the noise was said to be caused by other patients, visitors, but also staff and equipment. And the kind of suggestions that came out there were staff being more proactive, asking people to be quieter, staff being more considerate for the noise they themselves were making, lights being turned down earlier, having rules such as headphones having to be used for electronic devices. And older children also said they'd like to be in separate areas to younger children because of the noise that the younger children made. Next slide, please. So other aspects that came out were the comfort of beds and sleeping arrangements for parents, carers, and that was presented a challenge again to achieving a good night's sleep. There are a small number of comments saying that the comfort of seating and waiting rooms could be improved. When it came to temperature, we had some people saying it was too hot, some saying it was too cold in the hospital environment, but again, that could impact on sleep. And then the final aspect here was children and parents, carers expressing a preference for having private rooms. Where that was explained further, it was said that the lack of privacy could be stressful, could be distressing, overhearing other people that were upset, and also it meant the lack of privacy meant sensitive conversations were overheard by others. And again, children aged 12 to 15 wished to be separate from younger children to sort of protect their privacy. So that is a very, very quick tour across the qualitative findings. Similar to what AJ said, if you want to know more, I'd recommend you go and look in the main report, and there's a lot more quotes in there as well to back up the findings. But thanks, I'll hand back over to Amy at that point.
Thank you. Thank you, Estelle. Thank you for taking us through the qualitative results. Our next speaker is Samantha Luk. And before I introduce Samantha, I just wanted to say how lucky we are to have her here with us today. I would like to let you know that Samantha's talk is very powerful and inspiring, but it is also emotional, which some people may find difficult. Therefore, if anyone needs to take a moment or go off camera for a few minutes, then do feel free to do so. Please also note that there will be a few minutes break after Samantha's talk so that we can reflect on what we have seen.
Hi everybody, thank you for the introduction. My name, as it's been said, my name's Sam. I sit on the under 16 CPAs advisory group as a parent with lived experience. I had the privilege and the honour of coming last year actually in speaking here and telling sort of Henry, who's my eldest son's story, and talking about some of the good or positive experiences that we had when Henry had his cancer diagnosis and throughout his treatment. But also some of the things that we found really difficult, and really sort of put a thing out about, you know, how can we, you know, the things we found challenging and about how we could improve those things. Now, some of you were here, some of you weren't, but one of the people who was on that call was actually Davina, who's the programme manager from the Northwest ODN. And I still have it screenshotted actually. Amongst all the other lovely comments, she sort of really put out sort of almost a, you know, sort of a case for change to say, you know, I really feel that we should do something for, you know, about Wi-Fi, because that was one of the things we talked about, one of the real things that we found difficult that really sort of impacted on the experience of Henry and for us throughout our, you know, our time, Henry having treatment, and about how we could potentially improve, you know, Wi-Fi up and down the country, but do it in Henry's name. And I thought, great, brilliant. Didn't really think anything more of it, but Davina didn't let it go. And together we formed a group who have worked, you know, sort of quite hard, and have really come together with lots of people, you know, Anna, Joanne, you know, Rach, there's lots of different people who really came together. And what has come out is the digital story that you will see shortly. And it's an 8-minute video. I hope it will resonate with the, you know, the experiences of other children, young people and their families, that you can be seen through the survey results. It sort of adds sort of validation to what we said. It wasn't just Henry, and it wasn't just us as a family who are moaning about our experience. Actually, it does come out, it does resonate with other children, young people and their families. But what I would really ask is that you sit and you look at it and you think, as you're watching it, I think it's beautiful. It shows beautiful videos and, you know, photos of Henry throughout it all, is that you sit and you think about, who can I share this with? You know, how can we create change? How can we improve the experience of other children, young people and their families? And I don't want to say and sit and talk about loads of different things, because I just think the video really speaks for itself and it talks about our experience. But I just, while you're watching it, please just sit and think, who could I share this with? So thank you, and please play the video.
Thank you, Sam. We'll play the video right now.
Henry was 6 when he became unwell. He'd been having temperatures on and off, although it hadn't stopped him doing anything. I remember that it was the day he was going back to school after half term, and as I applied sunscreen, I noticed he'd developed some small spots like a rash on his legs and on his chest. We decided to get him checked out at the hospital, as when we rolled a glass over them, they didn't disappear. Henry had bloods taken in the emergency department and had some other checks by the team there. It was the middle of the afternoon when we were taken to a room where there were 2 consultants and a nurse who sat with Henry and my husband Wah and me. The doctors talked to us about the tests and the checks they'd completed. Our world literally imploded when they said the words, "I'm sorry, the tests have shown that Henry has leukemia." We didn't know how this could be possible, as he was so full of life into everything. Just that week he'd been swimming, been to the cinema, seen family, friends, ridden his bike and climbed trees.
I've lost sound. I don't know if anybody else has. Marcos,
Yep.
there's no sound.
No sound, yeah.
Unmute Marcos, I think. Sorry, Marcus, we can't hear you. If you unmute yourself, I think we should then be able to hear the sound.
For hospitals and
Yeah.
different teams, and our local children's community nursing team. He spent a considerable amount of time in hospital receiving treatment and having supportive care to help with the side effects and everything else that goes with a diagnosis of AML. Despite having brief respites from treatment, he subsequently relapsed twice, requiring both further intensive treatment and a stem cell transplant. Sadly, he died in February 2022, aged 9 years old. There were so many plans, protocols, all of which involved harsh treatments that were needed to physically treat Henry and his AML, and this was obviously an absolute priority. But for us, the everything else was just as important, as we wanted him to enjoy life as much as possible. After all, he was still a 6, 7, 8, 9-year-old little boy who was inquisitive and wanting to learn about the world and the ways of life. For Henry, being able to utilise the schoolroom, the playroom and the activities they had, the outside space to go and play ball, tennis, to sit in the big swing with his younger brother Edward or his cousins when they came to visit him, to relax by having a hand and leg massage, play board or card games with us and the staff. Henry was a whiz at cheat and normally won. Watching countless movies, to playing Roblox, Minecraft, or speaking with his friends and family over FaceTime really did make part of this horrendous experience slightly easier and provided those elements of normality when everything else was essentially in freefall. One thing we quickly realised was that the Wi-Fi was incredibly poor in whichever hospital we were in. This caused no end of arguments and stress as we tried to make the connections so that Henry and we could log on to whatever game he was playing, to FaceTime his friends whilst playing games, or to use his no isolation robot that had been kindly loaned to him by a local charity. The robot, nicknamed Tom, sat in Henry's classroom and became his eyes and ears by linking to an app on his iPad, allowed Henry to take part in his school class activities, whether that be maths or an English lesson, or even serenading his friends in the playground with their favourite songs. In later months, I required the connection so I could log on and work from the hospital. I became known for working late in the evening when the signal was better and I could log on and complete my work while I sat by Henry's bedside. I remember we used to be balancing the phone on shelves, ledges all over the place, just to try and get a good Wi-Fi signal and one that was strong enough to do the things that we wanted it to do. When Henry relapsed for the first time, it was May 2020. The world was in lockdown due to the COVID-19 pandemic. We knew that again Henry would be in hospital, in a cubicle, for days, weeks, maybe months, and in an even more isolated world, with no schoolroom, much reduced play activities, no volunteers, no visits from Edward or family or friends, and with only one parent swapping infrequently. We knew that strong Wi-Fi was going to be essential. My husband Wah managed to get a monthly contract for a spare phone, the provider of which we knew worked better in the various hospitals we'd been in during Henry's first diagnosis. This was an added financial burden that we didn't really need and couldn't afford, but we knew it was absolutely essential to help support Henry's mental health and that of Edward, his younger brother, and of us. Never underestimate the power of being able to communicate freely and to be able to take a moment from reality, especially when that reality really isn't that great. One day, Henry was asked by one of the nursing team if he would fill out a friends and family form, so he scanned the QR code with his iPad and completed the form. Now, when asked to rate his experience of care, he gave it the worst possible score. And when asked to say why he'd given that rating, he wrote in the free text box, "Because the Wi-Fi isn't very good, so I can't play online games with my friends or use FaceTime to talk to them." Now, I was slightly taken aback by what he'd written because he hadn't said that the nurses were great, my team are amazing. But this was what was important to Henry. Sometime later, when a play specialist came back to him, and said they'd spoken to someone who helped sort the Wi-Fi for the hospital. This person had responded with, "But why do children need Wi-Fi?" Now, on hearing this, Henry ranted for about 45 minutes to the ward sister about why Wi-Fi and internet access was important. I have absolutely no doubt that had Henry still been alive, he would have written to the various chief executives and anyone else who would listen and told them just why Wi-Fi in hospital is important to children. Henry always wanted to help others. It didn't matter who you were, how old you were, or where you were. He would do his best to help in whichever way he could. It was important to him. And so it seems fitting that we aim to make a difference to the experience of others who have to spend time in hospital, for whatever their reason. His legacy will be that something will change.
A very powerful and emotional message. Thank you, Sam, for bringing this onto our screens. I would like to ask everyone just to take 2 minutes to reflect, and we will be back with the rest of the agenda. Thank you. Thank you, everyone. We shall now move to our next topic, which is understanding the outputs. This will be driven by my colleague Caroline, our research associate from Pickers. Over to you, Caroline.
Thanks, Marcos. And thank you, Sam, for sharing that story again. I've seen it before, but it's still very powerful, so thank you. So as Marcos said, I'm Caroline, a research associate at Picker, and I'm just going to go through each of the different outputs that are available on the website. And just, I know that most people, it's a very busy time of year, wouldn't have had a chance to go through everything yet, so I'm just going to let you know what's available and just how to use it. So our results, you can find them either at a national level or at a PTC level. So at the national level, this year we have the National Quantitative Report. This includes an easy read version, and then we also have a qualitative report, national data tables, and we've got some visual summaries. Then at a PTC level, we've got each PTC has their own quantitative report and their own data tables, as well as free text workbooks. Next slide, please, Marcos. So all of these outputs can be found on the website. So if you just go to under 16 cancer patient experience survey.co.uk, then if you go at the top and you click on the drop down for results, you can go to the technical reports, and this is where you'll find the national results, PTC results, and some supporting documents. Next slide, please. So just to start off on that drop-down, we also have some visual summaries. So the visual summaries are just really nice graphics that we have, and then the graphics are for each section and then we've taken some questions from each section and put them on the infographics. So it covers things like overall care, diagnosis, communication, information. And then what's new for this year is that you can now download these infographics if you'd like. They're nice to use in presentations if you want, and you can also share them on social media. Next slide, please. Then we also have the National Quantitative Report and the easy read version of this report. So this is what reflects what AJ presented earlier on today, but it goes into a lot more detail. So he just provided a snapshot. So if you download that report, it will have a lot of the charts that you saw earlier, and it breaks everything down by yeah, so you can see a bit more about like the methodology and the eligibility and some of the demographics that we used, as well as most of the main findings in there and some of the main findings that are broken out into subgroups. And then this report is also available in easy read version. Next slide, please. And then the National Qual Report. So this reflects a lot of what Estelle presented today. So it just goes into a bit more detail about that, and that is available at a national level too. Next slide, please. So what we also have is the national and PTC data tables. So these are really useful to use because it has pretty much all the data that you can kind of play around with and find what you need. So at the bottom, you can kind of see there on the screenshot, there are different tabs. So we've got the guidance tab, which pretty much has an introduction and content of the file and tells you what is in the report and how to use it, and gives you some information about the scoring and how to understand the data, how the suppression level works, and how the confidence intervals works. Then you also have the next tab, which is the questions list tab that shows you which questions are in which different questionnaires. So which ones are in the 0 to 7 survey, and which ones are in the 8 to 11 and 12 to 15. Also, you can filter things down by survey section, as well as the question text. Then the next tab at the bottom is the About the Respondents tab, and this you can see the different breakdowns of things like deprivation that AJ spoke about, diagnostic group, long-term condition, and you can see breakdowns like that. And then for the National Scores tab, you can break things down by survey section, and then you can see the national score there, as well as the confidence intervals. You can also then go to the next tab and see things that are in the year-on-year scores. So if you want to, as AJ mentioned, just compare your results over time, it's a useful thing to see. Then for the subgroup data, this is pretty much the screenshot that you can see here. So this will have all the questions that you can filter by survey section or by the question, and you can see it broken down by each of the subgroups. And so that is the national Excel report. So we also have the PTC report. The main difference here is that you can filter it by your own PTC, which is useful, and you can see how your PTC compares to the national results. Thanks, Marcos. So we also at a PTC level have the PTC Quant report. So this one differs slightly from the national report. So it also has an introduction, methodology, and how to use the data sections. It also has a about respondents split by various characteristics. So like survey mode, diagnostic group, survey type, ethnicity, among others. And then it also has an overall. The overall care section is split into different subgroups, the same as the ones mentioned above. So survey type, diagnostic group, those kinds of things. Then also the PTC results section is, so not all the questions are covered in this report, just a handful from each section, but it covers things like finding out about your cancer, child's care and treatment, care in hospital. You can see all of that. Then also we have the year-on-year trend data, which is shown for all the comparable questions that have year-on-year So these, yeah, will show things from the 2022 and 2023 results, and the confidence intervals are displayed on all the charts as well. That's it for the PTC. Another thing that we're sharing is the free text workbook. So Estelle touched on some of this. So this was emailed to your survey lead. So not everyone will have access to it, and it's not on the website. But if you would like access to it and you didn't receive it, you can either email us and then we'll put you in contact with your survey lead that we shared it with. And then if they're happy to share it with you, then we could share that. So that covers things like, it also has a guidance tab, and it has subtopic descriptions. So all the subtopics that are included in the works book along with the description. Then it'll have the a report section with an interactive summary and some charts of all the qualitative data presented. Then there's also just an under 16s data tab, which includes just the complete free text data set, and then a data summary tab where you can filter different things, which is useful. So you can filter by survey type, or by PTC, or free text response, or by one of the topics, and it's very useful to have. Next slide, please. So the free text reports are really useful, and we don't have time to get into too much of it today, but Estelle, in a different webinar for adult CPAs, spoke about how to get the most out of this free text report and how to use them. So if you would like to watch that at another time, you can go to the ncpas.co.uk latest results page, and if you just scroll down, there's a video there, and it's really useful to go through that and see some of that. And then lastly, we also have the technical report. So the technical report is available in the supporting documents section. So it explores, as the title suggests, the more technical aspects of the survey in a lot more detail. So it will cover things like fieldwork, the survey methods used, how the question scoring works, and then there's often a lot of questions about suppressions. You can find details about that here, and the adjusted response rates, also how comparability works, and a lot more detail about the confidence intervals and how they're used. There's also a data limitation section. So it is very useful if you're wanted to know about the more data side of things or the more technical aspects. That's available this year too. And then lastly, one of the things I haven't spoken about, but something that is going to be coming soon, is that we are going to be having an interactive dashboard that will be released in a couple of months. But we will send out an email and let you know when that's available. So I hope everyone just has a chance, I know it's a busy period, but to just go through some of the outputs when they're ready. There's a lot to look at, and we hope, yeah, you get a chance to go through them. Thank you. I'm going to hand back to Marcos.
Thank you very much, Caroline. Our next topic will be Sophie's legacy. We have with us Charlotte, Sophie's mom and CEO of Sophie's Legacy organization. So Charlotte, when you're ready, please let me know, and I'll drive you through the slides.
Yep, I'm ready. If you want to go to the next slide.
Thank you.
So hi everyone. Yeah, as already said, I'm Charlotte Fairall, and I am Sophie's mum and set this Rarity up, Sophie's Legacy, in her memory. And I'll give you a bit of a background to her story for those who don't know. So next slide, please. So we were just your average family. I've got 3 daughters, Sophie being my middle of my 3. And we, you know, we both us parents worked, and when they were at school, they just had the normal children illnesses. They had, you know, no other sort of major illnesses at all until life changed for us. So next slide, please. So Sophie was diagnosed with rhabdomyosarcoma in September 20. So a bit like Sam's journey, this was in COVID times. All of our journey was in COVID. And she had 9 rounds of extremely aggressive chemotherapy, which was inpatient, and 7 weeks of radiotherapy. the whole of her abdomen in UCLH in London. Now that was in the second lockdown, which was extremely tough in our experience in London, because we were away from home. Everything was, you weren't able to access anything in that hospital because all the facilities for patients or visitors were shut. So when I asked where can I get food from, they said down the street. And I said, I don't even know where I am, let alone find a street and find some shops that only supermarkets were open. And obviously it was COVID, so it made it extremely difficult. And it did to us, so quite stressful time, to be honest, up there when I was up on my own with her. She went through obviously all of her treatment, and you can see in the picture there that everything within the green lines within her abdomen was the solid tumour. We did manage to get, obviously through surgery and her treatment, the majority of it did go, but sadly 8 weeks into maintenance chemotherapy, which just started out, she relapsed with a brand new tumour right in the area, pretty much where it was at the very beginning, in the area that had the most amount of treatment. Her body by this point was absolutely, it couldn't cope. She was struggling to cope with the last round of aggressive chemotherapy. So at this point, we were told that it was all about biding time rather than ever getting her cured. Now, age 9, it's sort of the last thing you ever as a parent want to hear, to be told about your child. So we'll go on to a bit of the next one, but obviously the other things that added to the stress is that I also lost my job when Sophie was diagnosed. I was a children's social worker before, and I wasn't able to get the time off that I needed. I was able to get 16 weeks unpaid off, but no more. So the financial burden that added to her being obviously unwell was huge, because our bills didn't just drop because I'd lost an income. It also meant that we had extra expense because of being in hospital. We were effectively running 2 homes, one in hospital and one at home still. So if we go to the next slide, please. So Sophie sadly relapsed in the June of 21, and she died on the 18th of September 21. So we got a few months of her while she was trying to achieve her bucket list of things that she wanted to do. And she was 10 in the August. We celebrated her last birthday. We knew we were never going to get any more. And she then died in the September. She did get her final wish, which was to die at home, which was touch and go towards the end, but we did get her out of hospital and at home. But she really wanted some things changed. So she wrote a bucket list of things that she wanted to achieve in the time that she had left, and managed to achieve pretty much all of those. But she also wrote some things on there that she made me promise her in her final couple of weeks that I would achieve in memory of her and become her legacy, basically. And these are things that she was never going to get to see. She was never going to see the outcomes. It's quite remarkable that a child of, say, just 10 that was able to see the difference that she wanted. And this has now become the backbone of the charity. I never thought I'd ever set a charity up, but it's become that, because in order to make these difference, the change, we've it's just rolled into that. So we go to the next slide. Now, obviously the survey picked pretty much what Sophie wanted changed. So one of the main really big things for her was around, she couldn't ever understand why I was not fed in hospital with her. She never wanted me to leave. She'd never spent one night in hospital prior to becoming unwell. So for her, it was quite a scary place. She was scared about being sick if I wasn't there, or in order, for example, in London, I mean, even though I was running to get out, it was still about half an hour by the time I'd got out, gone down the street, got down the 11 floors of the lift and everything. So for her in that world was a really long time. There was she often said, order my meal, mum. and you can eat it, tube feed me, because I don't like the food here anyway, and you don't have to leave. But what she struggled with was around eating and the smells and everything. So I ended up, there were facilities for parents to eat on the hospital. So the 2 pictures here are actually of mine, from meals that I'd ordered for her, feeling guilty that I was eating her food. And I was sat in the bathroom on the bins, eating my dinner, and that was my food. So she really wanted parents to be fed. And what we found is that actually only about 30% of hospitals in this country provide any level of food for parents that stay overnight with their child in hospital. So it's something that we've been really working on hard to achieve. And we'll talk a bit about that in a minute, about some of the things we've done. So next slide, please. The other 2 things that she was really passionate about was improving the children's hospital food. She was a girl who loved her food. Like from the moment she was born to the very end, to be honest, she was still arguing with the doctors when they said she couldn't eat and told them that they were cruel. She said, I'm dying and you won't let me eat. How more cruel can you get? So food was a massive thing for her. And she hated the food so much in hospital that she said, tube feed me, because the food is so disgusting. I'm not eating it in here, and I'll actually only eat when I get discharged out of this hospital. So she became a little stubborn, very stubborn one during our time. But she was really, really saying this food is disgusting. And to be honest, I tasted some of it and I would concur with some of the hospitals. Some were better than others, but the food for her was really poor. She was given food when she was throwing up. And now who wants to eat that? We were also given choices that she didn't like any of them. And then she was also, she wanted to eat in times that wasn't served. So obviously you normally get your 8, 12 and 5. Now she wanted often quite late at night, she'd be wanting finally something to eat, but wasn't able to access any food. So that 24/7 is really important. The other thing she found is that play specialists, they for her were really, really important. But at weekends, they often weren't around. And she'd say, but I'm still here. Are they saying I can't play at a weekend? So she wanted play specialists 7 days a week in hospitals and felt that that was really important. So we've been doing lots on all of those. Next slide, please. And I just add here that obviously Sophie fought to the very bitter end. She did not give up that fight easily. And she really wanted to show others how you don't give up easily. And we just now need to go and achieve these changes for her. We are 3 years on from Sophie dying, and I still can't pick off any one of her 5 wishes that she wanted, which is frustrating for me because we have put so much into this. But we just need everyone to really get behind these changes, and not just for children with cancer, but for every child and family that end up in hospital. Next slide, please.
Thanks, Charlotte.
I'm hoping you're ready to come on.
Yeah, I'm Sarah. I'm a project manager in the CYP transformation team at NHS England, and I've been working alongside Helen Benn, one of the policy managers, who's also on this call. I'm going to give a bit of background and an overview of the work we've been involved in with Sophie's legacy. Charlotte first got in touch with NHS England back in 2021 to share Sophie's story, along with Sophie's bucket list, which Charlotte's already described and included her poor experience of the food being offered, the lack of food for parents when staying with their children, and the lack of facilities, including, as Charlotte's mentioned, play specialists not being available over weekends. Next slide, please. In July 2023, we circulated a survey to all trusts to understand the level of provision of food and place facilities whilst children and their families were in hospital. It demonstrated that whilst there was a good understanding of the need to support children and their families, there was huge variation with what was offered, and it was clear that improvements needed and could be made. Following this, we've been working with the charity Starlight Foundation, establishing a task force, which Charlotte has been involved in, to develop standards, guidance and best practice for the provision of play and play specialists. This toolkit will be published early next year, and we will support ICBs and providers with it. There have been 2 pilots run around food provision for resident parents. The first one was in March 2023, and we supported 10 Children's Hospital Alliance trusts to run a variety of provisions to parents to offer them free meals. We are currently running another pilot with Sophies Legacy, who are funding 15 trusts to again offer the free provision of breakfast, lunch and dinner for parents. Next slide, please. This slide covers some of the initiatives which have and are being trialled within the food pilot, and they include vouchers for parents to use at the hospital restaurants, providing frozen meals and microwaves for parents to heat up, and expanding the food ordering system. So most importantly, parents can order and eat alongside their children. Next slide, please. We've received lots of positive feedback from parents during the pilots, and we've included some of the quotes here. A lot of the feedback has been around parents not having to leave their child to go and get food. Parents also not going hungry, one less thing for them to worry about, and also helping with the financial pressure that parents face whilst in hospital. Next slide, please. So looking forward, we are hoping to publish the play standards and guidance early next year. The current food pilots will be finishing in the next couple of months, and we will be sharing the learnings and best practice. The food standards are due for republication in 2025, and we are hoping to embed the requirement to provide food to parents and carers within this. And finally, looking at other areas which Sophie highlighted in her bucket list and how we can support in the improvement of these. We've included Charlotte, Helen and my emails on this slide, so if you've got any questions or if you would like any information, please do get in touch. And I will hand back to Marcus now, I think. Thank you.
Thank you, Sarah and Charlotte, for these powerful testimonies and for bringing Sophie's legacy and Sophie's wishes into the fore. Very, very powerful and emotional again message. Similar to Henry's story, I would ask everyone please to take 2 minutes to reflect, and then we will come back for the closing statement by Neil Churchill. Thank you very much, everyone. Thank you, everyone. I'll hand it over to Neil, NHS England Director for People and Communities, for the closing statement.
Hey,
Marcus, you may want to come off screen share. Sorry, Neil. You may want to come off the screen if that's okay, off the share.
Okay. Thank you and hello, everybody. But before I say anything, I think, Sam, you had some closing words to give on Henry's story. Do you want to come back in now?
Hi, everybody. Sorry, I feel like I've got take 2 going on. I just really wanted to say, just for the end of that, it was really going to be the plea to say, please share Henry's story. We really want to make change for other children, young people and our families. It's too late for Henry and for our experience, but we can go out there, but his legacy will be that something will change, but I can't do it by myself. We can't do it just with the ODN. So please, we really want this to take this to your board meetings, to your forums, to your conferences, to everybody else who will listen. And also, if you do know anybody who is in industry, who we really need to work with them as well, so that they can be part of this and really understand how they can make a difference and how they can improve the experience of children, young people and their families, not just, like Charlotte said, not just with cancer, but for any child, young person and family who's in hospital. So thank you. I don't know whether Davina also wanted to say something, because obviously the ODN are hosting Henry's legacy for me. Thank you.
Thank you, Sam. I just wanted to say, I mean, it's been an absolute privilege to work with you over the last year on this, and we, as you, really want a real change to happen as a result. And I think following such a heartfelt plea from Henry, which was so eloquently conveyed by you, Sam, and has been beautifully captured by Anna, it's something that we simply collectively just cannot ignore. We really need to make a difference here. And I think it's available on our website. As has been said, the link is in the chat. So please do play it, use it, share the story far and wide, and try and influence the key people who are able to make those changes that are needed on Henry's behalf, and then come back and tell us about any differences that you do make. Thank you.
Okay, thank you very much. I mean, it's most important to hear those words really from them rather than hear from me. But I think one of the things we can do is to make sure that those stories are heard by the people thinking about the new long-term plan for the NHS, which is being developed at the moment, both in terms of our organisation in the NHS England, but also it'd be good to see the Secretary of State seeing these videos, and let's try and make that happen. I just wanted to say really just a couple of words in conclusion. One is that it's a really distinctive survey. I think this one, I do see a lot of surveys that we do. They're all good, they're all important, but the issues that come out from this survey are distinctive. Hearing about Wi-Fi, hearing about play, hearing about food, but also the feelings that get expressed are distinctive. I can't think of another survey where people talk about what would make them happy, or what would help them to live and enjoy life. So it's really important that we hear these words and we act on these words. I think overall, clearly the feedback is encouraging, that people have a lot of positive things to say about cancer services for under 16s, but also very clearly there are things that we need to grapple with and improve. And I think we've all heard very forcefully today, both of the stories from Henry and from Sophie, and understand the legacy. It's great to see those legacies being so actively promoted, and we need to think about what each of us can do to support that, and to reinforce improvement in those areas. What I wanted to say really is just I think take some heart from the encouraging scores that you're getting from the survey, but also do look beyond the headlines. There were some positive scores, but there were also some scores which were less positive that we need to think about. There was an awful lot in that qualitative feedback as well, wasn't there? Things to look at and understand. And please do take these results away and share them with children, young people, with parents, with other service users, and discuss them. See what resonates, see what they prioritise, see what ideas that they can have. We do know from past work in cancer and other fields that just working with people that focus on co-production is a really good way of delivering the really high quality standards that staff want to provide and patients want to receive. So it's been really encouraging, I think, to look at how this survey has worked over time, and in your responses to it, it's good to see an area of NHS care which is improving over time in a number of key ways. I think we would all like to see improvement accelerate in some of the areas that we've heard about today, but there's a great amount of progress to build on in the year ahead. So please do be encouraged, please do focus on what can be done, and take it away and talk to people in your trusts and areas of work to see what we can all do next. Thank you very much.
Thank you very much, Neil. We are going to post the feedback form. There's a link in the chat for the feedback form to get your views on how useful and helpful you found the webinar and the information that was shared. Questions have been put in the chat, have been answered. If not answered in the chat, then we'll get back to you as soon as possible. Thank you to everyone. Any other closing points or remarks?
Just to thank you all so much, and in particular Sam and Charlotte, hugely inspiring. So thank you. We'll circulate the recording as soon as it's available, and it will be up on the Under 16 Cancer Patient Survey website. Thank you all for attending, and speak soon.